You're an organ donor.
Close your eyes for a minute. Imagine you're 8 years old and you have been in desperate need of a kidney for 8 months. If you don't get one soon, you'll die. 2 counties over, a group of teens are in a severe car accident, leaving one teen brain dead. The teen is an organ donor, a match for you. Your family is elated for the gift, but the teen's family is devastated by the sudden loss of their loved one, but happy their loved one can live on in someone else through a donated organ. I'm here to tell you how important it is to be an organ donor. I know thinking about your time on Earth coming to an end is never high on your list, but it is something we need to talk about. In the end, the decision you make could help someone in need and living on through them. During the past decade, organ transplants have increased significantly, but there is a shortage of organs needed, causing a major organ shortage crisis. The waiting lists are growing so rapidly that it's taking longer to find matches for patients, resulting in numerous patients on the waiting list dying due to lack of organ donors. According to Drexel University College of Medicine, a study in 2006, the number of patients in the U.S. on the waiting list for organs has risen over 95,000, while the number of patient deaths were over 6,300. This shortage has come between thousands of patients having a better quality of life and caused an increase in the number of alternative medical care. In January 2019, Finger Lakes Recovery Network reported that approximately 115,000 men, women, and children are waiting for an organ transplant in the U.S. One more person is added to the list every 10 to 12 minutes, meaning 20 people will die today because of this shortage. Nationally, there are only 58% of people that are registered to be donors. Just one person being a donor can save up to 8 lives. Since one donor can save up to 8 lives, it is time to act now. How do you become a donor, you ask? Depending on your beliefs, you can simply check the box when renewing your license or go to organdonor.gov and sign up. If you want to be a living donor, you have the choice of working directly with your family or friends that needs the transplant, or you could call your local transplant center and ask who is in need of a donor. Almost everyone can be a donor at any age. However, if the donor is under the age of 18, they need consent from a parent or guardian. Some people can't be organ donors. These people are HIV positive, have cancer, diabetes, kidney or heart disease, or a severe infection. I believe that if everyone becomes an organ donor, it can save so many more lives. Physicians follow 10 steps for successful organ donation. The first step begins at the scene where teams of EMTs and paramedics do all they can to save the donor. Next, the ER doctors and nurses check injuries and continue life-saving measures, which would include a ventilator, IV fluids, blood replacements, and medicine to keep the heart beating. The third step is intensive care. Once vitals are stable, the patient is taken to the ICU. Here, the doctors will conduct a battery of tests to see how much damage has been done to the brain and other organs. Next, brain death is declared, which is when there is an irreversible loss of blood flow to the whole brain, resulting in the brain dying. After brain death is declared, the patient's body is put on a ventilator to support the body. The fifth step is an evaluation by medical practitioners. From the Organ Procurement Organization, or the OPO, these doctors travel to the hospital to see if the patient is medically eligible for organ donation. The next step is authorization. Doctors talk to the family about the loved one's death, and someone from the OPO talks about organ donation. If the patient is a donor, the family is told, and the counselors are available to talk and explain how the donation process works and answer any of the family's questions. The seventh step is placement, meaning doctors still need to fill out the patient's blood type, height, weight, along with the zip code and other information about the hospital, and it is entered into the United Network for Organ Sharing, better known as UNOS. UNOS is a national computer system that finds matches to patients' organs. Next step is organ recovery. The patient is taken to the OR and organs are surgically removed. Once surgery is complete, the organs are sent to the transplant hospitals where candidates are waiting. After the donation, next step is the funeral. The patient's taken to the funeral home, and the OPO works with the donors to honor the donor and family's funeral wishes. The final step is the follow-up. After a few weeks have passed, the OPO sends a letter to the donor's family telling what organs were transplanted, keeping the names of the recipients confidential. But if the donor family's recipients want to contact each other, they may do so, but must follow OPO and transplant program communication guidelines. Organ donors can also be living donors. These donors can give up all or just part of an organ without having long-term health issues. Living donors do not have to have the same blood and tissue type as the recipient, but it is easier to transplant the organs if it's a match. The transplant team runs a series of tests to determine if your blood and tissue type are compatible. An example of a living organ donation is a kidney, a piece of your pancreas, intestines, liver, or lungs. The cool thing about your body is that it will adapt for the missing organ or organ part. If it is determined that donating will put you at a health risk in short or long term, then you will not be able to donate just for your safety. Since this is a donation, you would not be paid, which is illegal. The transplant program recipient insurance or recipient's insurance recipient should cover your expenses from tests, hospital costs, and some or all of your travel expenses. Like everything else, there are pros and cons. One of the pros of being an organ donor is knowing you will be saving a life. That life could either be your spouse, child, parent, sibling, close friend, or a complete stranger. A con about having a living donation is that the major surgery, and it comes with risks such as bleeding, infections, blood clots, allergic reactions, or damage to neighboring organs and tissues. Even though anesthesia will be provided during the surgery, you can have pain when recovering. The pain and discomfort can vary depending on the type of surgery. Most likely you will have visible scars from the surgery as well. It also all depends on your body and how long it will take for you to be fully healed. Even though there are pros and cons of being a donor, the receiver and their family would be greatly appreciative of your kind gesture. To me, it would be worthwhile. With all the statistics, it is clear that we still need more donors. This could be one of the most important decisions you make, but also could be the best gift someone could receive. I have told you the shortage of organ donors we have in the U.S., how to become a donor, what happens when you decide to donate while living or once you pass, and the pros and cons of being a donor. When you are thinking about whether or not you want to be a donor, pretend it is someone you really care about in need of an organ. Would that help you make up your mind? Or would it help you decide if your sibling was an organ donor? Would you want them to help an 8-year-old live a happy, healthy life with their kidney after their death? Any questions?